So, not being a very tech-savvy individual, I was friend requested by a current resident in one of the Orofacial pain programs here in the United States. About a year ago, he had a couple questions, particularly as concerns reimbursement in private practice. But then as we started to communicate with one another more often, he started coming with clinical questions. He was asking me how I would see, a great number of patients per day, where he's only seeing 1 or 2 patients per day in a team atmosphere. And I started to explain to him that I didn't start really learning how to do what it is that I do as efficiently as I do it today once I left my residency or my fellowship. That took years of postgraduate study on my own. And I told him, he's so focused right now on getting the right diagnosis and providing the right medication that's provided in his books that have algorithmic treatments. And I'm telling him, or I tried to explain to him, this is not what we want. I don't want you conditioned into thinking that you have to equate one particular medication with one particular disease. That medication is not the result of a deficiency or disease is not a deficiency of medication. That he needs to keep a wide view perspective of what's going on and a systemic perspective. And his philosophy of problem solving needs to be just as broad, so that whenever he has a patient come in, he can very quickly and very efficiently cut right down to the chase as to what the primary complaint is, but at the same time keeping a wide vista of ideas concerning the system as a whole when it comes to complete patient management. And that's what this talk is about, at least the introduction that I'm providing here. It's a very abbreviated version, but it gets to the point that here's a common patient that comes in. It's a common orofacial pain complaint. It's an everyday patient, but underneath that simplistic facade, there is an ocean of problems there that are affecting the balance of the system that need to be righted in order for this ship to sail.